Okay, so good morning and good afternoon to everybody. We are so excited to have this conversation today. My name is Tara, and I'm hoping that everybody can hear me. I'm the co-founder of Superkin, and Miriam is also on the call with us today. And we are so thrilled to have Dr. Courtney Bolton, who's a wonderful child psychologist. She's based in Nashville, Tennessee. And we felt like this was the right time. And, given this pandemic, we really, thought that, our brand voice is coming for women that are working. And now they are juggling these incredible dynamics between full-time childcare, full-time teaching, and maintaining a job, as well as their family life. And so it's a lot. And we know that, most of us are 7 weeks in. And so we really wanted to take this time to take a break for ourselves and really come back to thinking about how we can continue to manage this. And these are things that, we hope to never see again in our timeline, in our lifetime. So we're really thrilled to have everybody here today. And just to give you a heads up how this is going to go, we're just going to do quick intros. And then Dr. Bolton is going to take us through a quick presentation. We're going to be allowing, we have our chat function in Zoom. I'm sure many of you have been on plenty of Zoom calls the last few weeks. And so feel free to, if something pops up that you want to ask, feel free to jot down a question. We can get to that during the time, or we can wait until the end and ask those questions. So I'm hoping that everybody can hear myself, and I'm going to pass it over to Courtney.
Hi guys. Okay, sorry. So I'm trying to coordinate the tech as well as give this. So I apologize if I'm gonna just take a minute and make sure Miriam is also, our other Superkin co-founder, is also muted, and then I will jump in and introduce myself. And I'm really excited. Okay, I think I might be unmuting other people. Sorry. Hang on one second. For some reason, it's not letting me unmute her. There we go. All right, so I think we're all set up and ready to go. And I apologize, I'm bouncing back and forth with all of our slides, because every time I click, it seems every time I let someone in, I click the slides. So I'm really excited to be here with you guys. And I'm really excited in particular when Tara and Miriam asked me to do this. I was really excited because I felt like the brand really aligned with a lot of what a lot of the women that I work with. We had really similar communities, and I was also really excited just because this is something that I'm really passionate about speaking to and being able to help women through. So I am a clinical counseling and school psychologist by training, which means that I get to spend a lot of time with families and children in particular, both from a clinical aspect, but then also proactively working as a parenting coach. And that was one of the things that I did while I was on faculty at UCLA, was really get to work with families in general and teach parents skills. And so I really love just kind of this aspect of being able to work with you guys. I'm going to encourage, as we get into this, that you please ask questions. Feel free to chat. We'll unmute everybody at the end, or you can raise a hand through the participant section, but it will make it so much more valuable if you're able to really get your questions answered. So, and it's really nice to kind of be able to tailor the conversation. So I'm going to talk a little bit about parenting during a pandemic and some of the topics and issues that come up. I'm going to talk just briefly about the new juggle that is going on for everybody. And then I have 6 domains that are really prevalent in the stress literature and the stress research that I really encourage the women that I work with to start thinking about. And it's not that you have to tackle all of the questions or all of the areas and master them all now. It's a really an iterative process, but I just think it's really good, especially in a time like this where there's a lot of uncertainty, a lot of anxiety, to be able to kind of talk about some of those things. So first things first, I have started every talk that I have given in the last 6 weeks with just a moment and a word on compassion, self-compassion, and self-care. So my first call to order is to please be patient and compassionate with obviously your children, but with yourself and your partner. I know that, you know, especially with my partner, there have been moments where I have been so thankful and also have wanted to like rip his head off. And so this is just kind of that call and that reminder to be gentle on yourself. And we're all going to have those kind of that wave, those ups and downs. But just kind of reminding yourself when you do have them that this isn't a pressure cooker situation. Expect the unexpected. So I'm going to get into this. We're going to talk a little bit about some of the regressions. You might see some questions that might come from your children and ways to handle them, challenging behaviors that you might see that could start erupting if you're not already seeing them, and then some of the symptoms of grief and loss. And when I talk about grief and loss, the obvious one is the fact that there are people who are on this presentation, watching this presentation, who may have actually experienced death throughout this process. And I know it's touched our family, and there are others out there where it's touched. But even just the notion of it kind of floating in the ether for children can be kind of an overwhelming and scary thing, especially for our younger children. But really, children don't process grief the way that adults do until their early tween and even teen years. So the permanence of grief doesn't really come into play until they're about 9 or 10 years old. So I'm going to talk a little bit about that, but I'm also going to talk about another factor that has been coming up a lot in my practice, and that's loss of milestones. And that's something that I think touches all of us. So there was something that we were planning this spring that didn't go according to plan. And that's a loss. And there is a grieving process around that, right? So changes in plans, things at preschools or elementary schools. I know for us, field day is coming up. So I'm going to touch on that just a little bit. First, let's talk about regressions. So what regressions might you see? So if you have younger children, this is really, really common. You may have seen the picture. I've got 4 kiddos, and they span the ages of 18 months, 3 years, 6 years, and 10 years old. So we hit a lot of the different areas. And I will tell you that in some ways, they've all experienced some type of regression during this process. So you may see an increase in nightmares or a need for more like physical comfort. Another thing that you can see if you've got a child who's a potty training age is you may see them all of a sudden just decide that they are done with this whole potty training thing. They may have been fully potty trained before and may decide that they're just going to put it on hold for a little while. And that is all really typical. So we have different responses to controlling our behavior when we feel like we're out of control. And these are just some ideas and some things that you need to be aware of. It doesn't necessarily mean that your child, there's something wrong with your child. And so one of the things I love about this period is there is an increase in teletherapy. You can call your doctor if you feel like it really is a need. And one of the things to call out with like potty training in particular, that's perfectly typical that your child might start to withhold or start needing a diaper or maybe even a pull up at night. But what you want to watch out for is if they are holding it and you've noticed it's been a few days or it's been longer than a week, then that can actually lead to physical problems. And you do want to consult your pediatrician, or if you have a child development professional in your life, you may want to talk to them about some of the things to make them more physically comforted. So I'll talk a little bit about routines in a minute, but one of the ways that you can help all of these regressions is by getting into a routine if you haven't already. And I know that this is a tricky time because I think we've got 31 states over the next couple of weeks that are beginning to slowly open up. But for those of you who are continuing a majority shelter in place process or are kind of continuing in the same routine that you've been in, then it's really important to establish kind of that security of a routine. We also have summer coming, and this is going to be a summer that is probably not going to look like a summer that we've had before. So you may have trips that have been planned, camp that was canceled, preschool, or I know there are vacation Bible schools that are over the summer. So there are a lot of different things that might have come up, and now it's time to start thinking about how you're going to fill in those routines and juggle everything else. Questions. So questions that come from kids that we're just not ready to answer, right? So there are a lot of questions about COVID still. When do I get to go back to school? When do I get to see my friends? When do I get to hug my grandparents? You know, is this going to get us? Can we go into, I shared with Tara and Miriam the other day that my kids now, every Amazon package that arrives that we pull in, they're like, that came from Corona world, don't touch it. And so there is even like a new vocabulary in my house. And we're going to have to prepare them for re-entering the world and society and not being scared to do that, right? So some of the questions that come up are really difficult, and some of them are more existential, right? They're larger picture questions. So one of the things that I really recommend is, depending on the age of your child, answering it in as honest and as simple a manner as you possibly can. So this goes along with even talking about grief and loss. But one of the things that I like to do is liken it to something that they're familiar with. So if they're asking about coronavirus still, we talk about it just like we would talk about the flu or chickenpox, or that time that a kid in preschool had hand, foot, mouth disease and everybody had to be really good about washing their hands and keeping away the germs. And it's the same thing. We just add a different layer to that, right? So we add the layer of, when we're out at the park or when we're walking in the neighborhood this summer, we're going to have to be extra cautious about making sure that we don't run up to people, or that we don't give them hugs, that we remember not to shake hands, but we give, you know, a little bit of extra space. And so really starting to talk about space and time. If you've got younger kids, a really great idea is to give them a physical presence. So a physical idea of what distancing looks like when you're out in public, and start thinking about things like games you can play with hula hoops, or maybe putting out bean bags, and giving them really a clear picture of what does it look like to be 3 to 6 feet away from somebody, because that anything physical, they're going to anchor onto a little bit more. So again, liken it to conversations that they're already aware of, that they've had experiences with, and then also giving them really good physical guidelines in terms of starting to re-enter. And you do want to have conversations about the fact that we are going to be able to see everybody again, and it's going to be great, but we're going to have to do it slowly, and we're going to have to do it carefully. I know that we don't trust my 3-year-old at all. Like, I would love to put him on a leash if I could, but he's the first person to run up and want to hug somebody or say hi. So it can be a challenge. Taming tantrums. So there's a lot of behavior and a lot of outbursts that are happening right now because kids are frustrated. And just like us, we're frustrated. I have had outbursts, and I have the ability to regulate my emotions and plan and analyze. And yet it's just a frustrating time. And we talk a lot about the fact that it really does feel a little bit like you're in a pressure cooker situation. And I feel really privileged because I've really enjoyed the time at home, and we've been very fortunate that we have been able to manage with 2 parents in the household that aren't essential workers or called away or anything like that. But it's still hard, and it's still stressful. And our kids are feeling that stress, either from us or just from the stress of their situation and the grief that they're feeling over not being able to be with people that they love and friends that they want to see and are often accompanied or used to seeing. So we'll talk a little bit about the 6 domains later, but one of the biggest domains is belonging, and making sure that our kids understand that they're still connected to those people, like they haven't gone away. But so the more you can be in touch with any kids in the family or preschoolers by video and things like that, it's really, really critical for them. But also writing letters and getting engaged in that way, and telling stories. So one of the things that we love to do in therapy is something we call narrative therapy, where we sort of rewrite the story of what's going on. And the more you can do that, the more you shift your perspective. And so what we would do with this is talk about the adventure. And we really tried to focus on some of the positive things and the exciting things for kids about, you know, let's talk about what adventure we're going to have in homeschooling tomorrow, what adventures we're going to have in the house tomorrow. And it's a great way to sort of get them to think about this time as more of an adventure and an opportunity versus a time that we had to be stuck in the house and it was scary outside in the world. So that works for 3-year-olds, it works for 10-year-olds, and it works for 40-year-olds. So that really is one of those, narrative therapy is really kind of more of a shift in our perspective. And it's fine to be an idealist, but still not have any delusions or illusions about what's going on outside, but to kind of honor both of those pieces. The other thing with tantrums is resetting, I guess, the expectations of what home behavior looks like. And that's resetting them not only for you, but then also for your children, and making sure that whatever you're resetting is really, really clear. So we want to make sure that we're laying down really clear expectations for them, that we're setting appropriate boundaries, and that we're following through on those boundaries. So this would mean repeating yourself a lot and just making sure that you are really being diligent and following through. The other thing is supporting our kids with grief and loss. So I talked about this just a little bit, but I want to go back to the fact that this does mean grief in two different ways. So the first part of grief is obviously the fact that some people here may have been touched by loss, or your kids are maybe asking more questions about death and loss. And a big part of this is we're seeing it on the news. We're hearing a lot about death tolls. So they may be picking it up whether or not you're explicitly talking about it in the house, or you may have personally been touched by a family member. And what we would normally suggest for kids is to give them an opportunity to grieve and to say goodbye, and yet to also have an item or a way to hold on to that person that they've lost. So if they've lost a grandparent or a close family member or friend, then you really want to make sure that they have a way to effectively process that loss. The other thing, and the biggest thing that I can talk about here in this kind of brief time, is the fact that kids don't process grief in a linear fashion. It's not like they're going to be angry and sad and then they're going to work through it and they're going to be happy again. They're going to have days where you think that they're just fine, and then they might break down 3 weeks later. And so it's really giving them the time and sort of the space to be able to process that, and not be surprised if they ask you the same question over and over again, but it happens today and it happens 6 months later. And you think, shoot, I thought I handled that really well 6 months ago. You can repeat yourself. You can say the same thing. Just know that a lot happens from, again, birth to 16, a lot happens developmentally in the period of 6 months. Our brain develops and grows so much that we process things differently when we hear them, and it helps us sort of consolidate our thoughts, even to hear the same thing over and over again. So don't be afraid to say the same thing, to give the same advice. Don't put the pressure on yourself to have to come up with something new. Just validate their feelings. And if you're having big feelings, it's okay to share with them that you're also sad and that you're also frustrated, and that this is definitely a loss. It's just kind of nice to be there and to support one another in that way. The other thing is to talk about loss of milestones. So I mentioned there are a lot of things that people had planned, a lot of big events that come up that happen in the spring that we're used to doing, maybe a beach trip that people had planned, or a summer camp trip, something like that. And if you are already grieving that as well, kids are going to be really sad about that. So if you think about how their little emotions get really, really high and they get really excited about things, they do get over things really easily, but that doesn't mean that it's not a loss. That's kind of the big event in their world. And so being really sensitive to that as well, and also recognizing that some of that loss may result in some of that tantrum or outburst behavior, because they're trying to figure out how to get that attention and those needs met. In that case, you may want to think about giving them a little bit more leeway, still expecting appropriate behavior, but just really honoring their feelings a little bit more than you might if it were just kind of a behavior. If they were always tantruming because they wanted something and they didn't get it, or they didn't want to eat something at the table and that was kind of the household rule, then you may be a little bit more firm. But if it's something that's related to this period, you may want to consider having a little bit more leeway in your house to just sit and process and think about emotions. Just name the feelings that they're having and kind of give them space and let them know it's okay to have the feelings. It's not necessarily okay to have the behaviors. And that really depends on the boundaries that you set as a parent and what your values are for your household. Speaking of boundaries, boundaries are an amazing thing. And so one of the really fantastic things about boundaries is that it gives us a lot of freedom. And I know that everybody on this call has a very different view of routine and schedule and how well you implement schedules. But when it comes to children and when it comes to us, the more scheduled and more routine oriented we are in a time like this where kind of everything has gone out the window, the more we're able to actually juggle in our lives. And what I mean by that is if you give yourself blocks of time, you don't necessarily have to schedule out minute by minute every part of your day. At 6:35, I've got breakfast made and the kids are up. But if you give yourself blocks of time, and your kids generally know, okay, mom's going to be with me from 6 to 8, and we're just going to have fun time. We're going to snuggle, we're going to have breakfast, and that's our kind of playtime. And then from 10 to 12, mom has to be on her computer. She has to work. She's got to catch up and do different things. And then from, that's my independent playtime, or mom has an activity for me. And then from 12 o'clock to 1 o'clock, it's lunchtime and rest time. And that buys you a little bit of time. And then from 1 on, whatever it may be, maybe you have a partner switch, or something that another colleague of mine has been doing, which has been brilliant, is she has a mystery reader Zoom in, and she sent out a sign up genius, and a grandparent or relative Zooms in every day at 2:30 so that she can have a 15 to 30 minute break while her kids are Zooming and chatting with the grandparents. So there are a lot of different creative ways, but what I love about this is that gives you the time to schedule in your mind when you need to be in meetings, when you need to be responding to emails, when you need to be checking in with teachers, all of the different things that go on in the household, putting in the laundry, the dishes, all of that. So the other thing about consistency and routine, in addition to creating freedom, is that it allows for security and predictability. And this is why I absolutely recommend it for our kids, is that security and that predictability in a time where there's so much uncertainty. And a lot of times when kids ask questions, we have to say, I don't know, is huge. So this will also help diminish a lot of those behaviors that you're seeing. When kids feel like there's a boundary and they can be free within that boundary, their behaviors are actually really going to settle down, and so is their anxiety about anything that might be going on. I also want to talk just for a few minutes about space and relief. And so one of my areas of research that I really enjoy is an area called deep work and indestructibility. And although I am not advocating for that at this point at all, something that happens when we have time to when we make time for ourselves to just turn off, when we're not checking our cell phones, when we're not checking social media, when we're not Googling 50 different things to do with toddlers and infants and tweens, is our brain actually helps problem solve for us. So it helps consolidate our thoughts, it helps us think more clearly, and it only happens in the presence of downtime. So a lot of times we're frazzled and we're frustrated, and that really is because we are sort of on the brink of, not being able to just consolidate everything in our minds, and we're literally too divided and pulled in too many directions. So one of the best things that we can do for ourselves and for our families is to take that 15 to 30 minutes, and it doesn't have to be 30 minutes is ideal. It does not have to be all together, but even just taking a couple of 15-minute breaks, we know that will allow us to sometimes have our best thoughts and our best, problem solving, really. And so I think about this as being like the shower, like when you're in the shower. I know for me, like if I'm taking a shower and there's no other distraction, or if I'm out for a jog and I don't have headphones in or anything like that, like all of a sudden I have the best ideas. I'm like, oh, that's genius. But it really only happens in the absence of other distractions. So trying to take that time for yourself. That's the only thing that I'm going to ask you to add to this. I won't ask you to add anything else in terms of adding more to your day, but finding that time, that 15 to 30 minutes can be huge. And so I'm just going to share a really quick idea for finding a routine that works for you. One of the big things right now is parents are really struggling to figure out how to embed learning, find times where they can be a teacher, and then they can be mom, and then they can be a career woman. And one of the biggest things to remember is that children's work is play. So even if you have a 6-year-old or a kindergartner, a younger, children learn through creative problem solving, through critical thinking, through solving problems, through being bored. And we don't take the time right now, and in some ways kind of stopping and pausing. I know that there are a lot of demands for older kids if they are in elementary school with e-learning, that there's probably a lot with their online curriculum that they're going to have to be doing. But for your younger kids, in some ways, this is a gift, because really where they're going to learn is by shadowing you. So when you're making breakfast in the morning, let them count out things, let them pour in the mix. And I know that occasionally that can create more of a hassle, but if you go into it with the mindset of, okay, this is going to be like our prep for the day. And then I'm going to do something with them that I'm going to give them a cookie sheet with flour on it and they can go to town, and then I'm done for 15 minutes. That's going to be huge for them. And they are going to learn through that sensory play. So if you think about the 5 different domains, we're thinking about stimulating cognitive, social, emotional, motor, perceptual, which we think of as sensory, and speech language. And so any of those things, talking to them and having a mealtime conversation, just labeling things for your youngest ones, bedtime routine where you're reading stories, PE time. So that's what we do in our house. My husband takes them, the older kids, after lunch, and they go for a bike ride in the neighborhood, or they get in the garage and play. And then developing independence. So that can be as simple as letting your young children pick out their outfits in the morning, because it doesn't really matter because they're not going anywhere. So, but that is huge for them to be able to learn how to get dressed on their own. Okay, the last thing I want to touch on are 6 areas to explore to effectively manage stress. So this is all from the literature on stress. And there are 6 areas that we think of as pivotal areas. Purpose is the first one, and finding purpose in life is such a huge thing to take on. But what you want to re-examine right now is there an area that you feel like brings purpose to your life? And the reason that it's important to think about this is a lot of us found purpose in different ways before that they've been taken away from us. We're not able to find purpose in those same ways, right? So if you went to a job, it doesn't necessarily mean that your job was your purpose, but maybe there was somebody that you took care of at the job. You would check in on them, or you were mentoring them, and it's harder to do that now that everybody is remote and distributed. Maybe it's parenting, and maybe you're struggling with parenting because your child is with you all the time and there's not much of a break. So you want to just kind of re-engage with thinking about that domain in that area. Passion. This is a huge one. So passion is something that fills us up. That's like a hobby or something that we grow on over time. And a lot of us have passions when we're younger. And as children enter in and spouses enter in, we forget to retap our passion or to make our hobbies more prevalent. We really tend to put ourselves as moms on the back burner, especially when we're juggling everything else. But the thing that we know about passion is if there's something that you enjoy, like cooking or gardening or yoga, or I have no idea, then you really running, then you want to make sure that you carve out time for this, because it helps buffer stressful life events. So that is what we are looking at. None of us have ever really been through a pandemic before, but the idea of all of the stress literature still applies to us in this particular area. We're looking at things that help us buffer stressful situations. And I think that by definition, this fits that. Pleasure. So this is my favorite one on the list. These are the small little things that give you pleasure. So these are things like chocolate, great sex, a hot bath, things that just kind of in that instant give you just like a good hit. And then power. So thinking about things like what we're in control of. There's a lot that we're not in control of right now, and that can be really, really challenging. So there are things in our own domain, within our house, with our kids and our family, that we do have power over, right? So we want to find areas that we can control. And that's really what it comes down to. Thinking about what we control, not the things like government and how they are operating that are out of our control. People. So this I mentioned a little bit earlier. I am a huge advocate for friendship skills. So we know that having 2 to 3 close friends helps us buffer a number of stressful life events. My line of research at UCLA and currently is all on belonging and how to make friendships. And I've thought a lot about this, because how do you make friendships when everybody is distributed and away, and we don't encourage people to make online friends? But what it really means is identifying the people who are important to you in your life, and identifying the people who mean a lot to you and reaching out to them right now. And I know that that's happening more and more, but really being intentional about reconnecting with people. And I'll offer one bit of advice on this. So one thing that is happening a lot is people are texting, and they're kind of texting all day long. There are no boundaries. But what you may notice is that one of your dear friends, you guys are texting, and you're starting to get a little bit frustrated, or you're texting with a parent and you're getting a little bit frustrated, or a spouse. And what can happen is there's something in this research called interference, and using a specific type, it's most often texting or email, where you text and it's normal things, but then you start using it more heavily as a communications tool. And there's something called interference. And what you want to make sure of is that as you're trying to communicate with one another, that the technology that you're using, i.e. texting, is not causing interference. It's not causing that miscommunication or for you guys to sort of miss each other. So if you get something and you're like, wait, that's not what I meant. Like, why would they respond that way? Then maybe think about switching to video chat or picking up the phone and having a quick call, because that can help solve a lot of the frustration that may be going into some of the e-communication that we're using lately. And finally, perspective. And I talked about this with the narrative therapy. This is a huge area in terms of being able to sort of shift what we have control over. So if you think about shifting your perspective, and you think about what you are able to control, and then again, this isn't to downplay what's going on in the world, but it's really to identify some of the areas in your life that are going right, you know, making this again about more of an adventure and more of an opportunity than it is about something that's being put on you. It can have a huge effect on your ability to manage your stress at home. And it also has just a huge, like, it can change and shift the way that you react and the way that you interact with your family, and specifically with your children, right? So one example of this in the parenting world is if your child is having a huge outburst and you're sitting there thinking, why is he doing this to me right now? But then you realize that the outburst is really communicating something that they need. And you recognize that he's not doing this to me. He's doing this because he doesn't know how to reach me. It can really shift your perspective. And I know that everybody as a parent knows this, but sometimes it's just good to hear that just kind of going into the morning thinking, okay, well, you may have to reset your perspective 6 times or 30 times throughout the day, but just kind of stepping back and saying, okay, this is not about me. This is about the situation that this person or my child is in, and try to approach it from that area can not only help you, but it can really help them in their interaction as well. Okay, so I want to make sure that we have a chance if there were any questions. I think there may have been a couple. And so I just want to see. Okay. All right. So we have a couple of questions, and I think Miriam is going to moderate for us. But if anyone has questions, you can, there should be a chat box down at the bottom. And I would love for you guys to ask any questions that you have that are personal, any questions that you have that are child related or work related in terms of the juggle, or even just kind of stress related. So if anyone has anything that they want to put, please feel free to chat me. Or the other option is, I think you can, in the participant section, you can raise a hand and I can unmute you and let you ask the question too, because I want to make sure that we're really dealing with, or really answering the questions that people have. So somebody asked a question that comes up all the time, which is amazing. And this is, how do you deal with the guilt of taking time for yourself? And so let me make sure, Miriam, let me make sure you're unmuted. See your message here.
I think.
Oh, perfect.
Okay.
Okay, great. You're good. All right. So, how to deal with guilt of taking time for yourself. So this is a huge one. I mean, this comes up all the time. And this is part of the reason that moms don't take the time that they need for themselves. So what we talk about with this is, if you're not taking that time, the chances are you're not giving your family, like, really, truly the person that you are and the person that you need. So in terms of managing guilt, there are a couple of different ways to do it. There are some people who just absolutely refuse to take that time during the day when they're supposed to be with their children. That's why I really encourage setting up a routine that has it built into your schedule. And what I mean by that is, if there's a time where your child is away, that you're able, just again, 15 minutes, maybe twice a day, where you're able to sit there and just kind of have a few minutes scheduled in, where you have something for them to do. Everybody is busy. You have a partner that's taking that on, and you don't jump into work, then you can't feel guilty about it, because your children are taken care of, and then you're doing what you need to be able to take care of them when they come back. So that's one way to think about this. The other way is, if you just need that time, it's really going to outweigh any of the issues that come up in terms of the guilt. So what happens is we tend to feel guilty for taking the time, but then we also engage in behaviors that make us feel guilty or make us feel stressed. And that's not us giving our family our best foot forward. So I really try to embed it if you can. And then if not, at the end of the day, when the kids are down, take that time and make sure that that time is used for you to like sort of refill you up versus, having to figure out when to fit it in during the day. Okay. Anybody else?
I love that. A couple other questions that came through just to me. Someone was concerned about, and this resonates for me too, this idea of like, are we going to traumatize our kids when we say like, you can't, like when things reopen, like you can't touch grandma? Like some concern about like internalizing that. What are kids going to remember?
Yeah. So I think a lot of that is all about how we position it, right? So if you think about being safe or I think about newborn babies. So if anybody has a baby or has a new sibling, you've been through this, right? We've got to be gentle with the baby. We have to be careful with the baby. And then they get over it, the baby's around and it's totally fine. Our kids are really resilient. We talk about raising resilient children. By nature, our kids are resilient. But this is where narrative and perspective really come into play. So we really want to be mindful of how we talk about it. Our kids are really listening. It's funny. I talk about this a lot. Parents will come to me and they'll say, how do I get my kids to listen? And what we forget is that our kids are listening to us all the time, not only to our words, but to our actions, right? Are we overly anxious? Are we kind of relaxed and calm? I have a sister-in-law who is just like wound really, really uptight, and her kids are the same way. I mean, they know when things are coming, and we laugh. We totally joke. She knows, she's accepted it. And so we joke about it a lot in the family, but our kids do pay attention to those cues. So if we're able to say, hey, we just have to be gentle and safe, and it's sort of like a nonchalant, like this is how it's always been with grandma. And if you think about having an immunocompromised relative, if you have an older relative who can't be around your child with a runny nose, or, you have, again, a new baby in the house who needs like really gentle handling, think about likening it to something that they are familiar with. And I promise that will help them sort of latch on to, oh, it's just like when, my baby was born, or yeah, it's just like that time someone was in the hospital or somebody got sick and we had to just be extra careful with washing our hands, and then give them a replacement behavior. So this is something I don't think we're talking about enough, is that it's one thing to say you can't do this, or here's the boundary, but it's another thing to give them a proactive. So we tend to give our kids a lot of don'ts, and we really need to be giving them do's. So this is a great example, right? You can't touch grandma, but here are the things that you can do, right? So let's give grandma space. Like, we can reframe it in the positive. Make sure we give grandma space. We're on an adventure, and we're keeping everybody is staying in their own bubble, and they're all, and you don't have to say own bubble if you've got 15-year-olds, but if you've got younger children, we're going to stay in our bubble. Here's our bubble. And again, the hula hoop, whatever you have, might help kind of give them a little bit of an idea of what that space might look like. But then also thinking about, what they're able to do. We can blow kisses. We can write letters. We can make beautiful artwork. And all of these things are going to make grandma feel really good about the fact that, we're still thinking about her and we care about her a lot.
I love that. Okay, another question here. How to manage bedtime routine with both parents at home, and the kids prefer mom, but she's 7 months pregnant.
Yeah. Oh, well, I mean, this comes up all the time, right?
Yeah.
So there are a couple of different things. One of the things that we implemented often in our house was mommy snuggles, and these have stuck. But so you want to give two things. You want to kind of meet that behavior or that need somehow, right? So you want to be able to offer a way for them to get time with mommy. And especially if mom is 7 months pregnant, she's really going to want to have that time now, because it will become more precious. So what I always recommend doing is creating, again, the routine, because the more that you can stay within a routine, the more the expectation is there that this is the routine, this is just what we do, and the less kids will tend to fight against it. So when this often happens is when mom was the one who was doing bedtime previously, and you're going to reset a routine, right? So you're looking at resetting the routine, and what's going to happen in this is you're going to add something really special. And this is going to be special mommy time that happens before dinner or after dinner, before the bedtime routine. So I wouldn't recommend necessarily mom taking on bath, but what I love is, all right, dad's going to get you in the bath. We're going to get you all warm, snuggy in your pajamas, and then you're going to get cuddle time with mom. So you get extra cuddle time, and then you get story time with dad. So always make sure that it's going to be something really fun. One of the things we tend to do as parents is transition from a preferred activity. So, hey, okay, you're going to watch, your favorite television show for 30 minutes before bed, and then you're going to go to bed. And who wants to do that? No one. Or we're going to watch television, and then all of a sudden you're going to pick up your toys, and no one wants to do that. So you want to make sure that you're really clear about stopping the activity that they are engaged in, that they're excited about. And that might be snuggle time with mom, or any activity, picking up toys, whatever it may be, to make the transition easier. And then you're going to try to link it to something positive or more positive. That's kind of that next step, versus stopping something and then linking it to having to do something terrible like eat dinner. So, or something that would be less preferred. But kind of, again, thinking about reestablishing routines and resetting those, and then make it really rewarding for them. So the other thing is in that was coaching dad to make sure that he understands that there's got to be a lot of praise, and he's really got to like sell it in, because he's got to trump mom in this case.
Yeah.
I love that.
It's a great question though.
Yeah. One thing we always, like, we don't say it's time to go to bed. We say it's time to read books. And it's
right.
Like, he knows what happens after that, but we don't say it's time to go to bed.
But you're just getting them into the bed. And that's exactly the point, right? It's time, it's story time. Like, it's not time to go to bed, because then that's going to be met with a really different reaction. We talk about it, and it's very step oriented, right? It's time to brush our teeth and then pick out our book. And that's it. And then you forget about the brushing the teeth and fighting against it because you're excited about getting to the book. Perfect.
Oh, love it. Okay.
That's good.
Tonight. Here's another question. Like, strategies to take me time when your partner has one child, but you've got the other screaming because chaos when everybody wants mom.
Yeah. So this is what happens with moms, right? So one of the strategies to use is really clear communication with your partner. Now, this is going to be, can be much more challenging in this circumstance or this situation. But one of the things to use is distraction. So if you try to redirect your child and you don't necessarily say like, hey, you're separating from mom, but just again, engaging them in an activity that might be fun with dad. And moms, this is one more thing that you're going to have to plan for sometimes with your spouses, because our spouses are not, our partners or co-parents are not always great about this. But if you can save that activity that you like should get the mom win for and give it to your partner. So if there's something like homemade Play-Doh or something that they don't always get to do, like filling Jell-O with bags and like making it squishy and then getting to eat it. So something that dads get to be fun dads for a reason, but it really is sort of a bribe to make sure that the kids are going to be contained and settled while we're having our time. And sometimes that trade-off is just worth it. But so there's that. So there's that extra communication with your partner and really getting him to engage the child, but then also just having a really clear conversation with your children. And for working parents, this is critical too. And this is that really small thing of saying, mom has to have her time. Mom's working right now. Mommy's going to be here and then she's coming back, and letting them know. And so the bedtime question is a great one, right? So oftentimes we need our partners to put our kids down, or we need, just time and space. And we offer kind of that after this 15 minutes or after this period, then mom's going to come back and get you and she's going to put you down, or mom's going to have time with you right after this. But the other thing is not making it seem like we're just shuffling our kids off to the co-parent or to the spouse and like we're not there. It's really getting them excited about being with them. And again, that's where kind of the perspective and how we package it really matters a lot to our kids. Great question though.
We had to do that yesterday, with the shift of working hours between my husband and myself and managing the kids at home. It was my turn to work and I'm downstairs trying to hide out, I was like, I told my husband, here's some like banana bread, and the kids had the best time, daddy was the best because they all made banana bread together. And it was like, it definitely got them off of like, mommy, trying to bother mommy while she's trying to work. And it's hard. It's just trying to get it, get them, to have dad get the exciting projects to do. So
absolutely. My husband pulled out that Disney Princess cookbook and they made baguettes the other day, and I mean, a huge win. So,
yeah.
but being able to give your partner an idea, and as moms, we think about this a lot, and I don't want to, there are a lot of dads out there that do the same, but the burden really does disproportionately fall to the women to kind of manage all of that, and moms in particular. And so it is good to kind of have an activity or something to play with them.
We have a lot in our arsenal, I think, as women.
Yeah, it's true. It's true. And just kind of being mindful for that too. So there's a question I saw about managing screen time. And this was specifically for a 4-year-old who's obsessed with her tablet. Okay. So this mentions that they notice that the child, the longer she's on it, the moodier and more she acts out. So this is a really, really well-researched area. And I've been getting this question a lot of just like frank advice on screen time. And so I'm going to lay out some like really quick guidelines on screen time. But I want to talk about really quickly why psychologists are so adamant about limiting screen time, and even during this period. And it pretty much is exactly everything that's laid out in this conversation. So the first thing is, we know from research out of the University of Virginia that just 10 to 15 minutes of screen time for kids under 6 years old results in them not being able to activate their frontal lobe. So frontal lobe, if you think about it, that's where we execute all of our planning, where we analyze things, where we make really good decisions. The best thing that I can sort of liken this to is, and I'm sorry to use this term, but if anybody is familiar with like dirty old man syndrome, how older men just have no inhibitions whatsoever, it is a true psychological phenomenon. But they just say what they think and what's on their mind, and and this is something that happens a lot. Well, here's the thing. That is what you were doing to your children when they are on the tablet for 15 minutes. They don't have the ability to regulate their emotions in the same way that they would have. I don't know exactly, I've read a few different pieces on this. I don't know exactly what the mechanism is for that, like why that happens specifically. But what we know is it does tend to tire them out. They're not able to access it or activate it. And the problem is that the recovery can be significant. And what we found is the longer they watch, the longer that recovery time is. So what I tell parents is, if you have no problems with this, like if your children can watch television and you can say, okay, you get one 30-minute show, or for younger kids, you get 2 blocks of your favorite 15-minute show, then it's probably, and they're able to transition at the end of 30 minutes with maybe like a, no, I want to keep watching, but then you turn it off and they're fine, then it's probably not a problem. But if they pull out a full-on tantrum and they can't regulate themselves after that 30 minutes, then there are 2 things that you can look at. The first thing is, how are you setting up the screen time? Are you setting really clear boundaries and expectations on the front end? Now remember, children don't have any sense of time, like younger children, like it's, the concept of time is really difficult for them. But what we want to do is, and I give 5-minute warnings all day long, and then 30 seconds later, I'm like, okay, I gave you, we gave you your warning. Like, that's okay. You can say 5 minutes. And as long as you come back in within a reasonable amount of time, it's not like 7 shows later, 3 Disney movies later, they know, right, that, oh, okay, mom gave me a warning. It's time. It's time to get off the but you need to be really consistent. So we need to like clear expectations, and then we need to have consistent follow through. So that's huge in terms of just it being behavioral. Now, talking about the little one who gets a little bit moodier, there are 2 ways to approach that. One thing is you can limit the screen time to an appropriate amount of screen time where you notice that they are able to recover a little bit better, and you can truly set limits, and then you just have to be really good about setting those limits. The American Academy of Pediatrics has research-based, guidelines for the amount of screen time, and under 2, that's 0 screen time. And the other thing to think about is when you're calculating that is that secondhand screen time does include that, does count. What they're taking out right now is video chatting. So if there's some sort of interaction with familiar faces, then they're not counting that as in that screen time, as far as I have heard. So that, I don't think that there have been any updates to that. But the other thing to think about is lowering your expectations. And I know that sounds terrible. But if this is a temporary situation, then you have to just make sure that you're not setting unfair expectations on your child, because what you don't want to do is knowingly reduce their ability to regulate their emotions and then put them in a position where you have unfair expectations of them 20 minutes after screen time, right? So what I mean by that is I'm not going to give my 3-year-old the screen, let him watch for 30 minutes, and then tell him he needs to go pick up his toys, or he needs to sit down for dinner, or he needs to follow a series of instructions and expect him to be able to do that. He can't. Physiologically, he's probably not going to be able to do that. I am going to give him a little bit of a break, a little bit of space, suggest a couple of activities for him to sort of come back, for him to be able to sort of re-regulate and break from screen time. And then I'm going to, again, you know, put into place or impose those stricter expectations with him. But I'm going to be really clear about the fact that he needs some time to regulate before I start to do that, make those demands on him. So just be aware that we know screen time does have these effects. We also know that people need a break, and it is happening, and your kids are on tablets and things like that. The other thing I want to mention on this really quickly is the type of media that they're doing and using. So if they're doing something like a game that's a little bit more interactive on the tablet, that's a little bit different than, for example, some of like the YouTube Kids channels that are, they've gotten really, really good at pulling in what we think about as like passive consumption. So they've got great music, they've got cute babies, there's no words, like they're not really engaging our kids in a way where they're learning things. So the other thing is to kind of be mindful of the type of content. Does it require your child to swipe and to interact? That's going to engage their brain a little bit more than some of the like the baby Netflix and baby YouTube shows. And so just something to be aware of, because you may see a difference in the type of material as well. Good question.
I love that.
Any
I'm gonna
other
have to go
questions?
find some good iPad games.
I know, and it's tough. I mean, and I think the other thing, you know, to think about is that like the games, the iPad games are screen time, right? And sometimes we're willing to say like, oh, like you played a game or you did this for school, but we're, you know, they're on a lot. And you think about just being on the computer yourself, like your eyes need a break, right? The other day I looked away and I had vertigo, and I was sitting there thinking, how long have I been on the computer? Like, what am I doing? But we need to break, and we self-regulate. Our kids won't, so we have to be that that regulation for them. Mm-hmm. But also be gentle on yourselves.
Yeah, that's, I'm curious, just because you are in it and you're seeing probably a wide sort of cross section of, you know, folks going through this. Do you have any sort of budding theories about how, like what this looks like at work after the fact? Like how are the family dynamics changing? How are people's employers reacting? What is like, you know, a phase 2 of working motherhood look like?
Yeah, you know, it's interesting. I've actually been a part of a lot of discussions lately about this, and like, you know, what does it look like? And my hope, and I think that there's a shift happening. My hope is that companies will really start to engage moms in content, and there are some like coaches, like career coaches that help with this specifically, but that they bring in more resources and they offer that. So I think a few things that we're going to see. I do think that there will be, as much as possible, a flexible reentry, right? And I think not only a flexible, but a cautious reentry into the workspace. A lot of people are finding that if their employees are able to be remote, that they're okay with them maintaining that until we sort of get back through this. But I also believe that what we're doing is we're kind of proving out where and what areas it works. And I think a lot of moms for themselves are learning, okay, I am not meant to be at home working with my kids, or this is great and I'm able to manage it. So I think a lot of it depends on the threshold of like what you're able to do within your day. But my hope, and I think we're seeing a lot of this with companies like Maven and Clio, and I consult for and advise a company called Weldon that does a lot of work with companies in terms of just offering like parenting coaching, like how do you deal with these issues that come up? But I know that there are a lot, parentally is another one that really is focused on, you know, having moms go reentry usually after childbirth. But if you think about it, we're again bearing a lot of the brunt of, you know, what is happening and kind of maintaining the household and the consistency. And so being able to kind of tap into some of those resources going back in is my hope for parents and specifically for moms.
That's
Great question though.
Yeah. Thank you. So two more questions. So my kids eat lunch and dinner while watching iPads. How do I get them to not do that?
Okay. You engage them in what they're doing. So when it comes to food, I want to be really, I want to be really careful about how I say this, but I never recommend that you have any sort of media on. So one of the things that we know from studies is that the more we have like something that we tune into, and this actually came from very old school research in the 80s, was if kids ate, do you remember TV dinners? So if kids ate TV dinners in front of the television, this was like our Sunday night, there was a show called Rags to Riches, and I'm older, so nobody's going to remember this, but we would get Chinese food and watch like Rags to Riches. And they found that you actually eat more. You're not paying attention to any of your cues for satiety, so being filled up or anything like that. So it can lead to our kids like not really paying attention. And given the issues that we have with kids and food right now, I really don't recommend ever having any sort of media like TV or iPads or anything like that at the table. So the biggest thing is making the break and making it a clean break. So when we think about screen time behaviors, we really think about setting expectations in a way that is, we don't do iPads at lunch or dinner, right? We don't have them for meals, but then you've got to have what we call a replacement behavior. So you have to give them something else. And that means that someone has to either be engaging with them, and it doesn't mean that you have to sit down at the table with them. So my daughters asked me yesterday, this is so embarrassing to even admit this. My oldest daughter goes, "Mom, when do you eat dinner?" And I was like, "What do you mean?" And she's like, "Well, you're always up like getting stuff for us. So when do you ever sit down?" And I'm like, "I kind of eat while I cook because there are so many that need me." And that's a really terrible habit, and I'm going to work on breaking that right after quarantine.
I also love that she noticed that and identified that, because
totally called me out for it. Yes, which
is not necessarily a good thing, but it's sweet that she acknowledged it.
Well, I tell parents, if you want to know where your values are, like if you want to know, ask your children what they think you value. And I promise you they will be honest, and it will be horrifying, but it's also really good to know, because we think about like all the things that we do for them, and very clearly like they're, you know, we live for them. But then they'll be like, "Oh, it's all about, you know, getting the outfit from this certain store. It's all about, you know, your phone or, you know, your Instagram." I mean, whatever it might be that you spend a lot of time in, they will be the first people to reflect and tell you. So that was mine. Mine called me out for not sitting down at the table. So you don't have to sit down at the table with them, but like if you've got an area where you're doing food prep and they can come up and sit with you at lunch, or, you know, you can take a few minutes and engage or get them interested in something else, like making the food and then talking about the flavors of the food or what they like or what they don't like. So there are all these like little things that you can engage them. What colors, how many peas do you have? And it depends on how old they are. But you can start really early, even, you know, like with finger foods and things like that, but making sure that you don't have that and you give them something else to keep them occupied. My preference, as you kind of can tell from what I'm recommending, is that you engage them with being aware about the food, versus like trying to think about other things. But you can also engage them in just regular conversation about the day, right? What would you like to do after lunch? What would you like to do after nap time? What was your favorite part about the morning? So we have a lot of really positive routines that happen around mealtime. And what we know, again, from significant research, is that family dinners and family meal times are hugely important, and having conversations during those times is great. And those can start literally in infancy. So I know it sounds crazy to sit there and talk to your 1-year-old or your, you know, 9-month-old or 10-month-old who's eating puppies, but starting to like, narrate to them like, oh, you're eating this. You really seem to like this today. Oh, those sweet potatoes. Oh, you spit out the sweet potatoes all over the floor. Just talking to them about what they're doing exposes them to language. It engages them. So they're like active. And this is what I mean about, when we think about learning, it is happening throughout the day. We just have to be intentional about it. So if we're sitting there on our phones and we're talking to somebody else, and we're not engaged with our infants, then that's a missed opportunity for them that we could have easily built into the day. Now, if you need that time to be on your phone, take it. But, but it sort of is a trade-off, right? Like if you can take that phone call another time and be focused on the phone call and, doing the meal prep and being focused on your child, then it's kind of just being mindful of like where we can be present that might have more of like a bang for its buck, essentially. Mm-hmm. So I hope that helps, but definitely in terms of eating, I don't recommend having screens because you sort of lose kids should be focused on eating and that should be your time and their time to focus on that. And then the screen time can be a separate time for them where you get a little extra time to do dishes or whatever it may be after the fact. And that might be something too.
Awesome. Thank you.
So I saw a question about brain damage. Okay.
Yeah, so one last question, and then it looks we're just a couple minutes over, but I'm curious about this too. So is the brain damage to the prefrontal cortex permanent or compounding, or is it just the immediate time afterwards?
Yeah, so unfortunately, what we know about long-term exposure and excessive exposure to screen time in early years is that children who watch more screen time have something there's an area called gray matter. And they actually do tend to have less gray matter and less connectivity over time. Mm-hmm. So if we take brain scans of a 5-year-old and brain scans of that same 15-year-old, and, in that 10 years, they've been playing video games and spending a lot of time on, screens, then we do see less gray matter. And what that basically means is it results in a number of different ways, but we talk a lot about like increases in ADHD-like symptoms and things like that with our children. It does affect our ability to critically problem solve, like all of the things that I was saying about being able to sort of take that downtime. It can affect our inattention long-term. So it can have negative effects long-term, longitudinally on things like being able to pay attention, being able to problem solve, some of that critical thinking, some of that organization and planning. And it really tends to look more like, a lot of the symptoms tend to look more like ADHD long-term in teen and then early 20s and later. So there is some research that shows that it does have long-term consequences. But I hesitate to say that because there are a number of different factors that go into research that looks at that. So again, it's a reason that psychologists really recommend that you not put your kids on screens all the time. But the big thing is when they're on a screen, they're missing an opportunity, right? So they're missing opportunities to have their hands in the dirt and be digging a garden or be building with blocks or, kind of be exploring different things that have tremendous benefit to the brain. And so that's really what, initial research was based on, was if they're engaged with a screen, then they're missing out on these other opportunities. And so it really kind of depends on your family and what opportunities and exposure they have otherwise. And if people are engaged, and are in conversation and dialogue and reading to them, and will they sit down with books for 30 minutes versus look at a screen? And of course we know that part of what has happened with screen time is that psychologists have gotten really, really good at capturing attention, right? So we think about the attention economy, and that applies to our children, unfortunately. And so if you think about your phone dings every 2 minutes with, some sort of update or notification from somewhere. So we're picking up our phones all the time. And I mentioned that work on like deep work and indestructibility. Well, our attention is divided, and that's what's happening to kids. The thing is, our brains have had the chance to develop and theirs haven't. So they're constantly, their attention is constantly redirected. So they don't have the amount of time to just sit in like passive thought with a book and wonder aloud. And so it really does affect their ability to like, think through things long-term and to work through their own problems. And that's really what, as parents, we're hoping to get them through too, is right, to scaffold them in this like learning process and to make them the best learners possible. So it's a double-edged sword, but there can be some, some long-term consequences, unfortunately.
So deep breath for that.
Great to end on that note. However,
yeah.
let me back up there. Let me end on this note, which is, if this is a temporary situation, like if you are using the iPads and things like that temporarily because right now you need a couple of hours, then I don't want people stressing out who are like in that routine. There are a lot of ideas and activities and like getting kids in front of books or different things. Again, mixing up the type of media is a good way if you have to have that time. But the biggest thing is in taking that time to be present with them. So the time that they're not on the iPad and you're not working, take that time. And my hope again too is that employers are being a lot more flexible or offering a lot more flexibility and a lot more understanding in this case. And not everybody has that ability to take that flexibility. A lot of us are self-employed or whatever, but being present when you're able to be present and just trying to really buffer that time and give as much in that time will help offset a lot of the issues that come along with screen time. So I don't want it to seem like it is, complete loss. It's not. But there are things, again, that parents should just be aware of and be looking for, and then either readjust the behavior or readjust their expectations of what their children should be doing after that time.
Yeah. I want to definitely ask one last question because, so folks that have newborns at home or who are pregnant now, but thinking about, what is this going to look? How am I going to, have childcare or, like how am I going to figure out how to have a newborn in this new world? Any strategies that you've heard for planning for that?
Yeah. So the biggest thing that I can talk about when it comes to like fourth trimester and planning right now is to start now. So there are a few different things that you can do. And I know that, in my practice, we see a lot of couples and families. And what we do is we negotiate a few different things. So the very first thing is, this is a really stressful time. It's a stressful time to be pregnant, and it's a stressful time to have a child. But a lot of things are set up beforehand for parents. So like before this all happened, there were coaches who walked people through what to expect, how to set up not only your birth plan, but to really start planning for fourth trimester. So this is something that as a psychologist, like prepping couples, we talk a lot about. What's your value system? Like, what are you hoping for? And then how are you going to address it when that doesn't play out perfectly? Because we know it doesn't. And this again is work that we have been doing for forever. So how are you going to cope? Like, what are your must-have demands going into childbirth? We all have a birthing plan. And for those of you who are first-time parents and watching this, I know you guys are right there with me, but we don't talk enough about the fact that we create birth plans and we focus on all of this, and then we get this beautiful baby and we are kicked out of wherever we are birthing and sent home, and we're like, wait, what now? Like we've spent 9 months with like an army of people getting us prepared and throwing parties and doing all these things, and then we are alone with our co-parent, spouse, partner, and the baby. And you're like, oh man. And there are a number of different things that come up. And sometimes adding a person into that mix is a good thing, and sometimes it's not. And that really depends on your personality going into it. So there are things to think about, and building out your care team now is a huge one. Are you going to have a postpartum doula? Not necessarily a night nurse or somebody who's there all the time, but just somebody you can call. Is there a lactation specialist that the hospital or birthing center might have that you can talk to? Do you have somebody to talk to about making what we call a postpartum plan? And so we actually do a birthing plan and a postpartum plan, and that's a huge part of going in. So you create the birthing plan, you have your birth experience, which is your story and your birth experience no matter what. But it may not always go according to that plan. And so a lot of times moms need space to process through like what that was like, and, sort of explore like, was it exactly the way I wanted it? Was it better than I thought it would be? Did it meet none of my expectations? And I'm sitting with those feelings. And also now I'm not quite sure how to connect with this baby, or I'm madly in love with this baby, but I don't want to see anybody else, and I don't know how to communicate that. So there needs to be a lot of advocacy. So I really recommend couples who are together start talking now about what are the signals, what are the questions, like having some of those hard conversations of, there are a number of different ways that this can play out. I need you to be my advocate. I need, when I tell you this, to help me, work through having time away from the child, or being able to isolate by myself and run interference with family members. I mean, there are a lot of different things in fourth trimester that come up already. One of the biggest things that I have heard about fourth trimester is the isolation right now. Because often, a few weeks in, moms are able to get out and take walks, or maybe start baby groups a little bit later. And now, without having family be able to come visit, or having kind of cheerleading happening in the hotel rooms, it's not where I gave birth, but happening at the hospitals, then that can be, again, it shifts, kind of sort of the experience of getting to bring your child into the world and becoming a mom in that way. And so definitely looking for communities and groups that can support that, and or having some mental health care provider or coach or doula. I'm a huge fan of doulas, even if you're going to have, a traditional medicated or C-section birth. I think that they can just help be that comfort and support a lot if you don't have somebody in your area who, really engages in that. So.
Yeah, I like what you said about the postpartum plan. I think
yes,
so much, like, I just have to get this baby out and then it'll be fine. But I think it was shell shocking. And
yes,
even if you're prepared and you've read things and you're a capable human, it's still really hard. So I like the idea of creating a postpartum plan.
yeah. I highly encourage doing that type of planning. And that can include things like who's going to be so a lot of the things that you would include in a birth plan, right? Who's going to be my support team during this process? Who am I going to call if I need more people, or more interaction or less interaction? Who am I going to call if I have questions? I had the fortune of having a friend who brought over this bag that like horrified me before birth. And it was like all of the things to have on hand afterwards. And I'm like, what are these ice packs for? Like, what, why do you have a spray bottle? Like, what am I doing with
that for?
It is horrifying. And I was like, wow. But I was so grateful after the fact to have had her, because I was like, where are those witch hazel pads? Like, where, so there are all these things that like we get prepared for. And if you don't have the benefit of having someone kind of on your team, then it really can be a challenge. But I definitely recommend a lot of those same things, again, that go into the birth plan. Like, what do you want your cocoon to look like, right? What do you want the nursery and your experience to be like? So you probably planned a lot of those things, like baby's going to sleep with us, and but then what happens if baby's crying all night? Is husband or partner going to be in the room, or is he going to be upstairs because he's got to be the one working and taking care of everybody in the morning? So kind of starting to think through some of those things. And then also, again, like what does your care team look like? What does your what's your idea of like, do you need a check-in? Do you not? Do you want to like raise the red flag if you need to, or have a code word, versus like them coming in and asking if you need to be medicated? So thinking about all of those things postpartum is really, really important.
Mm-hmm. That's amazing. Well, I think we're, I know that there are probably 1,000 questions we could ask. We would love to potentially do something like this again. So stay tuned for everybody that's still with us. And Courtney and Dr. Bolton, this is amazing. So we are, taking notes throughout the entire presentation. We will share this with everybody so they can reference that, and we'll give the contact information. So if there's any follow-ups or any interest, we can kind of take it from there.
Great. Thank you guys so much. Thanks everybody for being with us. Appreciate it.
Thanks everybody. Stay safe and stay healthy.
Thank you. Bye everybody.